The three reasons for doing the project: better care for the patients, less cost for the system, and understanding how we as a system contribute to the problems. The Super Utilizers pilot came out of the Healthy York Network, trying to determine how we can control our costs. We're a regional charity care program, and we had seen the number of people that we cover had just continued to go through the roof.
We came up with the idea of trying to take a small pilot of patients who had a high utilization of our resources, ED visits, hospitalizations, and see if we could interact with them in a different way, and by doing that, to see what kind of impact we could have.
The Healthy York Network looked across York County and identified 12 patients, in this case super utilizers, to participate in the pilot.
If you look at their healthcare consumption in the 18 months prior to the start of the pilot, they consumed over $2 million in healthcare, most of which, or much of it, which we thought was probably avoidable. Most of our patients in the pilot had an overlap of some significant social and/or mental health problems with significant medical problems. And that combination was a toxic combination for them and for the communities. Providing better care was one of the goals. Decreasing the cost of the write-offs was a goal, to try to see if we came alongside these patients in a different way, could we actually shift their utilization of healthcare services towards more of an outpatient realm, away from the ED and the inpatient world, and what would it take to do that?
The Healthy York Network approached a number of physicians to take part in the pilot, including Dr. Mike Wilson of Stony Brook Family Medicine.
How are you doing?
I'm hanging in there.
I saw it as a way to improve the care of a certain subset of patients here in York who utilize a lot of services. My patient, before getting sick, was in business for himself, quite successful actually, carried his own medical insurance, but as he became ill and had multiple hospitalizations, he eventually lost his business and therefore lost his insurance, which then made it very difficult for him without insurance to get the medicine he needed, to get to patient or physician visits. However, we were able to quickly enroll him in the Healthy York Network, and that was an excellent safety net for him, and it helped him out tremendously. Okay, you can put your arm up on the table. We'll double check your blood pressure.
Dr. Wilson and other caregivers involved in the pilot went above and beyond the care they normally provide patients outside the pilot. Pilot patients received help in finding cost-effective transportation to make it to appointments. The network provided cell phones for patients so staff could easily contact them, and for staff so they could be easily accessible to patients. One patient, a diabetic, was given a fax machine so he could fax his blood sugar results to his endocrinologist in a timely manner. Staff from WellSpan VNA Home Care visited some patients to help them organize their pills. A third of the physicians made house calls, and others, like Dr. Wilson, simply touched base with the patients more often.
I actually called him and communicated with him more directly and more frequently than I do with other patients. I was calling him to see how he was doing primarily, also seeing if he was getting to appointments with other providers, checking in to see if he was getting his prescriptions. So I did make more telephone contacts outside of the office settings with him than I do with my normal patient panel.
In some cases, including that of a severely diabetic patient with numerous inpatient visits, all of his caregivers came together by teleconference.
We had on the phone at one time the primary care physician, the endocrinologist, the visiting nurse, the inpatient hospital team, and social work, all on the phone at the same time, and the emergency room was on the phone too. And it was amazingly helpful when everyone could understand what was going on in the patient, have their input. We were able over that hour to develop a complete plan for this patient that was critical to the emergency room acting decisively and effectively the next time he came in and preventing an admission.
Some patients even received help in finding safer, healthier places to live. One of them was Michael, who prior to the pilot project would visit the emergency department 3 to 5 times a week.
A lot of Michael's interaction with healthcare, and particularly the emergency room, was loneliness and the inability to find that in a constructive setting in the outpatient world because of his really significant mental health issues. Our intervention, mainly every day, touching base with him frequently or several times in a week. We do some medical and we keep track of his medical problems, but it's simply having people that he knows cares about him that are going to show that to him without him having to go to the emergency room to get that. He's healthier, he's not in the emergency room, it's more appropriate care.
From a hospitalist perspective, we welcome this concept. What we see as hospitalists are the patients who come in over and over again and are readmitted with the same problems. And it's frustrating because we can only do so much in the hospital to take care of them, and then when they leave, it seems like they're on a treadmill and they come in with the exact same issue. We've already seen results in those folks that we would see coming to the emergency department on a weekly basis, on a monthly basis, and those that have been involved with this pilot have actually stopped coming.
The statistics bear that out. The number of inpatient stays decreased by 19%. The number of ED visits declined by 27%, and there was a decline in observations of 33%. All of this resulted in a decrease in overall charges of more than $400,000. The Super Utilizers program is more than a WellSpan solution. It's also a community solution. That's why the Healthy York Network saved a spot at the table for community partners like York County Human Services.
I began going to the meetings, and truly I was fascinated by what they were trying to do, and really the number of people that are super utilizers within their system as well as our system. The next step is really how do we use the information and the data, because they've been collecting data, to drive how we do a better job in coordinating and working together.
We felt that we could come up with a way to actually make a difference that actually was like a win-win-win situation. So it won because the patients got better care, it won because the community spent less resources doing it, and it won because it pointed out multiple opportunities that we as a healthcare system were contributing to the problem and that we need to be aware of and then try to fix.
I can't even begin to express how important that hope is, you know, and you start to see them have hope and realize that they can manage their diabetes, that it really isn't this huge complex thing that they feel so foreign about.
People could say, well, that's just some ramped up feel-good charity care project. And I would argue it's not that either, because really I see it as the ultimate lean project. So lean is about finding waste in a system and trying to methodically figure out how you get rid of the waste so that you can provide more value.